A cancer diagnosis can paralyze a patient and their loved ones. What non-physician support is available to them during their cancer journey? You're listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm your host, attorney and Dr. Bruce Bloom, President and Chief Science Officer of Partnership for Cures, a nonprofit that drives cures to patients through repurposing current therapies for new uses. And my guests are Kim Thiboldeaux, President and CEO of the Wellness Community, and Ellen Stovall, President and CEO of the National Coalition for Cancer Survivorship. They join us to talk about a variety of free services and other support available to cancer patients and their caregivers. Kim and Ellen, welcome to ReachMD.
Thank you, Bruce.
Yes, thank you so much.
Kim, what is the Breakaway from Cancer initiative, and who are the nonprofit and for-profit partners?
The Breakaway from Cancer initiative is a national initiative, and it is designed to raise awareness of all of the wonderful free support and educational programs that are available for people with cancer and for their loved ones. And we're thrilled that the Wellness Community, my organization, and the National Coalition for Cancer Survivorship, the organization that Ellen leads, are the two nonprofit organizations that are the partners and beneficiary of the Breakaway from Cancer campaign.
Are there any for-profit partners? Is this supported by anybody else out there?
Yes, the project is supported by Amgen, the biotech Amgen, and we're both organizations incredibly grateful that Amgen stepped up to support Breakaway from Cancer and to work in partnership with both organizations to raise awareness of the support services that we're providing all across the country.
So let's talk about the two organizations that support the Breakaway from Cancer initiative. Ellen, tell us about the National Coalition for Cancer Survivorship and its role in helping patients and caregivers affected by cancer.
Sure. Well, Bruce, the National Coalition for Cancer Survivorship really helps patients, caregivers, family members deal with a cancer diagnosis by really giving them the tools by which they can become better advocates for themselves and how to create better partnerships with their healthcare team so that both parties feel empowered to get the very best possible care that they can. And as we distinguish ourselves as organizations, I think what's great about this partnership with the Wellness Community is that organization provides free support to people all over the country, and we refer so many people who call us for that kind of support because our mission is really to advocate for quality care and to use the sort of the power of the people, if you will, many of whom attend wellness community programs throughout the country to see that they can go on to become advocates for others after they've become advocates for themselves.
Kim, tell us about the wellness community's mission. Is it similar or different from the mission of NCCS?
The mission of the Wellness Community really is different from NCCS, but as Ellen mentioned, we're very close partners. I call us first cousins because we work so well together and are so closely aligned in supporting the needs of cancer patients. NCCS is really doing that at the national level, the policy level, the advocacy level. The Wellness Community is a nonprofit that provides free support and educational programs to people with cancer, people with all cancers at any stage of their disease, and also for their loved ones. We have now 27 centers worldwide where we provide support groups, educational programs, exercise, nutrition, stress reduction for folks, all free of charge. And then we also have online the virtual wellness community. So if someone doesn't have an actual, brick and mortar wellness community in their backyard, they can get online, they can get support groups online, education, and all of the same services and support that we provide through these centers. And I'm pleased to share with you actually that we've celebrated our 25th anniversary this year. So the organization really continues to grow and has a wonderful 25-year history behind it.
Tell us a little bit, Kim, about how did this get started? Did it start as a single wellness center and then spread, or was there a plan to have 27 of these right from the beginning?
It was founded as a single center, founded in Santa Monica, California in 1982 by a gentleman named Harold Benjamin. His wife was diagnosed with cancer, and he thought, wow, Harriet's really getting great medical care, but not really getting support. No one's really getting to the heart of who she is and what this experience is like and what impact it's having on her emotionally. So Harold actually sold a very successful real estate practice, went back to school, got his PhD in psychology, and founded the Wellness Community in a little yellow house in Santa Monica. He never really dreamed that it would grow to such a large organization, and I think his vision was right on because I think that when patients become educated, it's a very scary thing to face cancer, and when patients become educated, when they become empowered, when they work in partnership with their healthcare team, they will certainly improve their quality of life, and they will be able to cope with the diagnosis of cancer with a team approach with people around them who are going through the same experience. So I think 25 years later, we look back and realize that he did have an extraordinary vision.
Ellen, you mentioned that you have specific tools that patients and their caregivers can use to work better with their healthcare provider. I noticed on your website there's something called the Cancer Survival Toolbox. Can you tell us about that?
Well, the Cancer Survival Toolbox is a totally free program, has won many, many awards that exist in both audio format as well as PDF format that people can download free. It's offered in several different languages, and it includes a basic skills set that covers topics such as, communicating with your healthcare team, how to make informed decisions, how to problem solve and negotiate for your care, and to know what your rights are as a patient. I think we're particularly proud of the fact that the toolbox keeps expanding along with the resources and support of social workers and nurses and physicians who review the content material that help us keep it contemporary and keep it up to date along with issues that are increasingly of concern to people with cancer, particularly older Americans and people who are at the end of their cancer survivorship and have fewer resources to call upon.
If you've just tuned in, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm your host, Dr. Bruce Bloom, and I am speaking with Kim Thiboldeaux, President and CEO of the Wellness Community, and Ellen Stovall, President and CEO of the National Coalition for Cancer Survivorship. They join us to talk about the variety of free services and other support available to cancer patients and their caregivers. Kim, let's talk specifically about the Breakaway from Cancer. How did it get started, and is it associated with other nonprofit functions or events?
The Breakaway from Cancer, Bruce, is actually a complementary component of the Amgen Tour of California. And the Amgen Tour of California is a world-class professional cycling event that takes place in California. In 2008, it's going to happen from February 17th to the 24th. And it is an incredibly exciting event. And Amgen, who's the title sponsor of the tour, said, we don't just want to sponsor this tour. We want to make it meaningful. We want to build a component to this tour that's going to reach out to people. And so in the partnership with the Wellness Community and the National Coalition for Cancer Survivorship and Amgen, we've created this program. Folks can visit breakawayfromcancer.com. That's the website to learn more about the Wellness Community, to learn more about the National Coalition for Cancer Survivorship, to learn more about the tour. Another exciting piece of this project is that Patrick Dempsey, Dr. McDreamy from Grey's Anatomy, is actually the spokesman for the Breakaway from Cancer campaign. His mother is a two-time ovarian cancer survivor, and he's just been wonderful in helping us get the word out about ways that patients can be educated, ways that patients can be empowered. We want, Ellen and I think through this campaign, really want folks to know that they do not have to face cancer alone. They can find support. They can find education. They can get involved in advocacy, whether it's at the local, state, or federal level, and really learn that by being educated and being empowered, they are going to get through this experience.
Ellen, I noticed up on the Breakaway from Cancer website that there are cancer patient profiles. How do they get there, and why is that part of the program?
Well, Bruce, it's so important, I think, for anyone facing cancer to feel the sense that there are other people out there who are going through many of the same experiences that they've gone through. By telling your own personal story, it just validates a lot of the feelings that you're having. It tells people who visit the website how those folks have coped, how they found other resources in addition to the Wellness Community and CCS. One of the great things that Amgen has done is it's been able to profile, a lot of cancer organizations on that site where people can go to for specific cancer. If you have colon cancer or lung cancer, breast cancer, prostate cancer, the Wellness Community and NCCS both deal with all types of cancers, but those personal profiles really get to the core of what people are experiencing themselves and allow other folks to see themselves almost in the mirror, if you will. And it allows people to post their own story as well. The website asks people to tell their story. And we know how, Kim and I both know how powerful it is. At the Wellness Community support groups, which I've attended, it's sort of the recounting of other people's stories that provides the kind of support to people that's sort of priceless. No physician's office can possibly take the time or the resources to provide that kind of support that's needed in those cases. And the extension of support is also, like I said, telling the story to others and then going on to become advocates for others by hopefully engaging in public interest advocacy that maybe will get those resources that we want paid for by health insurance plans and value them as much as they do the treatments that people are getting.
Bruce, I just want to add to what Ellen's saying, and there's a lot of data out there that shows that when people are faced with a cancer diagnosis, regardless of the diagnosis, they experience three common things. They experience a loss of hope, they experience a loss of control, and they experience a sense of isolation. And I think through the resources on the breakawayfromcancer.com website, through the resources of all of these organizations that Ellen has talked about, people are learning how to take back control of their life, to take back control of their illness. They're learning how to connect with other people who are going through the same thing. And I think also through the stories that you're talking about and through being a part of these organizations, they're finding hope. They're connecting with others, and they realize that they do not have to face cancer alone and that these resources are out there for them. And I think the stories and the other resources on the Breakaway from Cancer site really inspire people and get them in touch with the support, the hope, and the resources that they need.
Ellen, I've seen on other places cancer survivor, cancer fighter, stories like this, but on the Breakaway from Cancer website, I also noticed that there are caregiver profiles. It's the first time I've seen that. Do you think that has the same impact as the cancer patient profiles?
Bruce, I absolutely think so. I mean, at NCCS, for example, we've always defined a cancer survivor as anyone with a diagnosis of cancer, and then all of those caregivers and others who advocate for them and support them. I think caregivers are often the forgotten survivors. They're the ones, all the attention is going to the person diagnosed with cancer. And I know that the wellness community holds support groups for spouses and partners and family members and children of people with cancer for that very reason. I think that, physicians in particular listening to this program, I think would find it tremendously valuable to both nominate or suggest to some of their patients that they put their profiles on there, their family members do, and that the physicians themselves put their profiles on there to talk about the experience of treating people with cancer. I think all of this information just takes away some of the stigma and fear and mystery that people all experience when they have cancer.
Cancer patients and their caregivers need all the support they can get. I want to thank Kim Thiboldeaux, President and CEO of the Wellness Community, and Ellen Stovall, President and CEO of the National Coalition for Cancer Survivorship, for talking to us about their organization's Breakaway from Cancer and the Amgen Tour of California. I'm attorney and Dr. Bruce Bloom, President and Chief Science Officer of Partnership for Cures, a nonprofit that repurposes existing treatments for new uses. You've been listening to the Clinicians Roundtable on ReachMD XM157, the channel for medical professionals. We welcome your questions and comments. Please visit us at ReachMD.com, where you can find our new on-demand and podcast features that will allow you access to our entire program library. And thank you for listening.
This ReachMD program is featured on Sermo, a free online community exclusively for physicians. To discuss this program with your colleagues, visit www.sermo.com. That's SERMO.com. When you join, enter ReachMD in the promotion box to receive a $15 Amazon gift card.